medical diagnosis, what you need to know from the LAB360 perspective, which obviously is a global perspective as well. And this is in a bid to mark our 1-year anniversary of existence within the medical space here in Nigeria, precisely in Abuja. Next slide. So looking at our outline, there are a few items we'll be addressing in the course of this webinar. So we'll quickly look at what medical diagnosis is all about briefly. We'll look at facility and safety. We'll run through equipment, through to assessment. We'll wrap it up with organization. Obviously, we would elaborate on the role LAB360, has to play as it has to do with medical diagnosis. Next slide, please. So what's medical diagnosis? In a layman's language, it is said to be the process of identifying a disease or condition from its signs and symptoms. In the field of medicine, doctors would obviously look at signs and symptoms, but within the laboratory space, we look at what causes those signs and symptoms. So the underlying factors that are behind the signs and symptoms. This obviously helps the doctors with their prognosis as well as treatment. Next slide. Now, for a laboratory to function properly, it has to work within a space. Hence, we call it facility. And it cannot be any kind of space. The space has to be safe for its workers, has to be safe for the general public, and has to be safe for its customers. Within a laboratory, there are a lot of aerosols that are produced, a lot of germs and bacteria, and a good laboratory ensures that it contains all of that waste, I would call it, so that it's not exposed to the general public. So a good laboratory ensures that its staff and its customers, work within a safe environment in a bid to produce a diagnosis. Next slide. And of course, within this facility, you need tools to work with. And for a good laboratory, of which LAB360 is a typical example, you need automated equipment, which would definitely help with accurate and timely results if properly handled. So before you go into accuracy of your results, you need to purchase the right equipment. You need to ensure that the equipment are installed properly. Preventive maintenance needs to be done on the equipment as well to ensure that they are functioning at all times. And this would obviously lead to accurate and timely results. Next slide. Then within the equipment, you need what we call reagents. So these are chemicals that are mixed with blood samples collected from the patient to produce a result. Every good laboratory must have what we call a good inventory system that ensures that these consumables, the equipment need for the production of good and quality results are readily available and are stored in such a manner where its integrity is maintained. Because of course, if you're producing results from bad reagents, definitely you'll be getting bad results. So it's very essential that the consumables used within these machines are viable, so that every result that is being produced, it's something of high standard and could be relied upon. Next slide. Now we've talked about reagents. Now we're looking at process control. Now your equipment have been set up within a facility. You've got your reagents properly managed. Now you need to run your patient samples through the equipment that's got the reagents. So firstly, the samples must be collected properly. Each test has specific bottles that are used for its collection. So the right test must be collected in the right bottle from the right patient. And these samples must be handled properly, because at this stage, it's quite crucial that the samples are handled properly. Hence, it could affect the outcome of your results. So LAB360 takes into cognizance the fact that the processes that the sample collection processes are properly done. The samples are handled properly. They are centrifuged so that we get them ready to be put into the machine for reliable results to be generated. And of course, we run quality controls through our machines as well. This is to help in checking, the functionality of the equipment as well as the reagent, just to be sure that everything is, 100%. Next slide. Looking at assessment, as a laboratory, you don't just function in isolation. You are not permitted to do what you like or what you deem is best for your organization. You are benchmarked by a standard. So LAB360, as it were, is benchmarked by a global standard, and that is where assessment comes into play. So we have assessments both internally and externally. Internally could be done by a member of our staff, whilst externally it's majorly done by regulatory bodies. And these bodies could either be locally or internationally located. So they ensure that our practice, is at par with global practice. Next slide. Now, personnel. I consider personnel as the most important laboratory resource, because, we've talked about facility, we've spoken about equipment, we've spoken about the reagent, we've talked about samples that are collected from the patient. Now, all of these need to be put together by humans. So we need competent, trained, and motivated workforce to ensure the generation of reliable and accurate results. So LAB360 has definitely put this into cognizance in its employment or recruitment processes, so that the workforce are not only trained, but they are competent in the duties and activities that is assigned to them, all for the interest of the patient. Next slide. Of course, the customer. It is always said that the customer is king. And taking a step back, the concept of customer service has been overlooked within the laboratory space. Many often than not, it's considered that customers only apply to organizations that deal with fast-moving consumable goods, like your dairies and things that it's being used on a daily basis. But the laboratory, it's also a service-oriented business whose focus definitely is on the needs of its patients or customers and meeting those needs, it's always our delight in LAB360. Next slide. Occurrence management speaks about events that shouldn't happen in the first place. So this could be attributed to errors that could happen in the process, and every good laboratory should ensure that they mitigate against errors. Now, take for instance, collecting blood samples from a wrong patient, regardless of the result that is produced by good equipment and good reagents and high quality personnel. At the end of the day, it is a bad result because you've collected the right sample from the wrong patient. Obviously, the outcome cannot be right. So LAB360 have a mechanism in place to ensure that patient identification is duly attended to during sample collection, and this cuts across all phases, of the laboratory processes. Next slide. Continual improvement, they say the room for improvement is one of the largest room in the world, and it's our primary responsibility as a competent laboratory to ensure that there is continuous improvement processes, within our laboratory. And this comes in the form of training and retraining of our staff, enrollment in external quality assurance programs, running quality controls on a daily basis. It also cuts across receiving feedback from our client and adjusting accordingly, and having regular meetings just to know where we are, what we need to do to get to where we need to get to, and to ensure that our customers are satisfied. Next slide. Speaking of document and control, these are guides that helps us in the way we do things. Within a laboratory system, reproducibility is the order of the day. Now, for you to be able to reproduce a process accurately all the time, there must be a document to be referred to. So within laboratory LAB360, we've got documents we work with to ensure every personnel is at par with our system. It's just like an eatery. For you to produce that recipe on a continual basis and putting repeatability in force, you must have a documented process to ensure that every step of the way things are done, the LAB360 way. So documents cannot be overemphasized. In LAB360, whatever is not documented is considered as not done. So document is key towards satisfying our customers. Next slide. Now, information management. The product of any laboratory, and that includes LAB360, is information. And primarily, this information is in the form of test results. So everything LAB360 has put in place thus far is for the generation of just one thing, information. And what is that information? It's the diagnostic report, for each individual patient. And we do not end at generating accurate, timely, and reliable results. We ensure that the results are properly managed, so that we keep them as confidential as possible so that it doesn't fall into the hands of a third party. Next slide. Next slide. Next slide. Organization, it's one key factor that brings to bear everything we've discussed thus far. The structure and management of a laboratory, and that includes LAB360, must be organized. Now, this is where an organogram comes into play. If we are very familiar with an organogram, it tends to spell out the duties of every member within an organization and its reporting structure. It is said that organization is the cure for ambiguity. So nobody's assuming that, well, Mr. A is expected to carry out task A. Everybody understands where he or she fits within the organization. And LAB360 has mastered this in such a way that everybody understands their role. Everyone's got a KPI, what we call key performance indicators. And this helps simply for everybody to play his or her role in the customer journey. Remember, everything we do is tied to the customer. Next slide. Now, all of these we've discussed thus far. What do we do at LAB360? How do we ensure that our patients are satisfied? We carry out timely and reliable pathology tests, and we've got an array of testing that cuts across hematology through to endocrinology, and we do bits of microbiology and coagulation studies as well. And all of these is to ensure that we obtain an information about every patient that walks through our door. Such information aids in diagnosis, aids in their treatment, and as well as the prevention of disease. Of course, within a controlled environment, we've got an ambience reception office. Our lab is state of the art, of course, manned by trained and well-qualified personnel. Our result helps the clinician to effectively treat the underlying cause of ailment. And that's where LAB360 comes into the play, as it has to do with medical diagnosis. Next slide. In summary, LAB360 International Limited is the preferred medical laboratory for all your diagnostic testing, because we are first and foremost reliable, we are timely. If you look through our website, most of our testing are done within 2 to 6 hours, so you get your result the same day. Even the ones which tend not to be available within the country over the past decade, we've made available. So for some of your tests, you could wait and get them, instantly. But all our tests, definitely you get your result, which we call information, on the same day. So we are quite timely, and we put the needs of our customers over and above our needs. Thank you for listening, and enjoy a beautiful day. Obviously, we are open to questions. You could throw out your questions and would attempt giving answers to them as well. Thank you very much.
Thank you, Mr. Joseph, for this session. We already have a question. I'm not sure if you could have a look at it on your screen, or do you want me to read it back to you?
Yeah, you can read it. That's all right.
Yeah, the first question is from Florence Awodoga. The question says, how does your laboratory manage the samples collected from the clients to avoid cases of mismatch / wrong results to clients?
Okay, that's a very intelligent question from Florence. In the practice of laboratory sciences, obviously, the idea of mismatch cannot be overemphasized. Remember, we talked about occurrence management, which deals with errors that do happen. And most of these errors are avoidable if the right systems and mechanisms have been put in place. For LAB360, we ensure we've got what we call unique patient identification. This is a unique number for each and every patient, and it's something that is unique to a patient. So no two patients can have the same unique identification. We call it the barcodes. So every sample is barcoded just to ensure that every patient is recognizable, even when their samples leave the phlebotomy room into the laboratory. I did hint on patient identification. First and foremost, we ensure the patient is identified by asking them to repeat their surname and first name, and sometimes their date of birth, just to be sure you're working with the right patient right from the sample collection phase. At that initial stage, the samples are barcoded, as I've mentioned earlier on, so that when they go into the lab, they have a unique identification on them already. So this is one of the ways we work towards ensuring that there are no mismatches, amongst the numerous patient samples we process on a daily basis. Hope this helps.
Yeah, so Mr. Joseph, thank you for that answer. I'm not sure if Ms. Florence is okay with the answer, but while we wait for a response from her, there's another question from one Mr. Olalekan Said. The question is, he said, mine is not a question, it's a comment. First and foremost, I would like to say big congratulations on your 1-year anniversary. I think that's basically all. Thank you, Mr. Lalekon. Then I'm checking through. Right now, there's no new questions on board. I don't know if you would like to buttress on some of the tests we run and how we carried. Okay, one moment. I just got another question from Florence Aodogo again. She said, can you share a list of the tests being carried out in your laboratory to enable us patronize and refer where need be for some tests that are not readily carried out in other laboratories?
Okay, thank you very much for that inquiry. Now, LAB360 has got a website. So if you go to Google and type in lab360.ng, it takes you to a website. Within the website, there is a barrage of laboratory testing that we do. It's all listed there. And I mentioned earlier on during the presentation that we actually do testing around hematology. So for hematology, we're looking at things like the full blood count, which is the FBC. Some people, they refer to it as complete blood count. It's got different names. You got complete blood examination. So that's one major hematology test we do, and you get a result the same day. We do malaria testing as well. We, of course, do the erythrocyte sedimentation rates. For coagulation, we do the prothrombin time and international normalized ratio. We do the activated partial thromboplastin time, which is the APTT. That's for coagulation studies. We do fibrinogen as well. Then obviously, if you move over to clinical chemistry, we do the kidney function test. We've got your electrolyte, urea, and creatinine. We do the liver function test, and that cuts through your total protein, your albumin, your ALT, AST, your GGT. We do the LDH. We do your bilirubins, that's your total and your conjugated. Then, of course, we do glucose, we offer calcium, we offer inorganic phosphorus, We do magnesium, we do iron, and a host of others. Then looking at our immunoassay platform, we do infectives. By infectives, I'm referring to your HIV 1 and 2 antibodies. We do the hepatitis C virus antibody. We also do the hepatitis B envelope and the core antibody as well. We do your hormonals, which cuts across your progesterone, your prolactin, your follicle stimulating hormones, your luteinizing hormones. We do the prostatic specific antigen, the PSA for males above 40. That's a regular test that needs to be done at least annually for every male that is above 40. We do the beta HCG test, which is the pregnancy test, and these are quantitative tests. We also offer ANA, which is the anti-nuclear antibody. We do the double-stranded DNA. So a host of tests, is being handled by LAB360. We do your glycated hemoglobin as well, which is one of our selling points. That refers to the HbA1c. It's good for patients who are diabetic, just to help in monitoring their treatment. For microbiology, we do the basics for now, though very soon we'll open a full-fledged microbiology department. But currently we handle urinalysis, we do the urine chemistry, but very soon we'll be looking at doing microscopic culture and sensitivity and blood cultures as well. So working on that phase of the laboratory. So these are some of the tests that we offer in LAB360, and they're all available on our website as well.
Thank you, Mr. Joseph. Currently, I've not seen a new question, but I can say Florence has responded to say, thanks for the insightful response to my question. It was well addressed, and congrats on your anniversary. More wins. Mr. Olalekan Said said, the testimony in LAB360 is very efficient and cost effective. This is based on my experience with the test I had carried out with the lab so far. I actually compared the price and timing of the result with other lab twice and found out you guys are the best. So I think that's basically all the questions and comments we have for now. Anybody with more questions can post or raise your hand while we wait for any more questions and the time spent. I don't know if Mr. Joseph or Ms. Young can share with us other things that we do at LAB360. Thank you.
I'll leave the floor open for Ms. Young. So, Ms. Young, please feel free. Whilst we wait for Ms. Young, I would want to say that in LAB360, in as much as we are more than willing to handle your referrals from your doctors and clinicians, we do corporate screening as well for organizations, vis-a-vis for the banking sector and for corporate organizations as well. Then, most organizations, during their employment process, they want to ensure that they're employing healthy workforce. So we are involved in that process as well. We do food handlers testing, just to ensure that your housemates, are free of the necessary evil, we'll call them. So you want to ensure that first and foremost, before they come live with you, that they are not pregnant and they've got a clean bill of health as well. So we handle all of that. For hotels who are willing to run food handlers tests, we've got the competence to handle that. We also do screening for intended couples, because obviously before you get married, most often than not, the churches, they send you to a diagnostic laboratory just to ensure that both of you have compatible blood type, to avoid scenarios where you give birth to sick class. So we run genotype, we run blood group as well. So it's very important that as an individual of a marriable age, you should know your blood group and genotype. So even before the church sends you, it's something you could do on your own. You want to know your HIV status, it's something you could just walk into a facility and request for. So these are some of the tests or packages that LAB360 offer to the general public. I'm sure Inform should be ready to maybe add one or two things to what I've said so far.
Good afternoon, everybody. Thank you so much, Mr. Joseph, for your time, and your presentation was wonderful. You said it all basically. I really don't have, I'm sure of what to say right now, but also we are still up and running with the whole anniversary, and we are going to be having another outreach. We're going to next weekend, we're going to be having another outreach next weekend, and we are inviting you all to be participants of our outreach and invite as many people as you can to our outreach. We would appreciate that. Thank you so much, Mr. Joseph, and thank you everybody that came on board with this event. We really do appreciate you for having the time to engage with us. So for the meantime, I would pass it back to Mr. Joseph. If you have anything to say, please do.
Just as an appetizer, considering we're celebrating our 1-year anniversary, we're offering discount on our testing. So that's all our tests. So whether it be the routine test or specialized test, I think that's a percentage discount, attached to each and every one of them. And I'm sure you want to take advantage of that, because it's not going to stay that way, year in, year out. I think that's going to run for around about 2 weeks, a month, thereabout. So please take advantage while it's still on, so that you could get a discount on all your testing.
Thank you, Mr. Joseph. Basically, there's a comment from Esther Agbo. She says, thank you, Mr. Joseph, for an insightful presentation, and a big congratulations to LAB360 as it turns 1. Then there's a question again from Mr. Olalekan Saidi. He says, so what is your spread in Nigeria, or how can patients outside Abuja enjoy any of your services? There's a comment from Ade Shokwa Yusuf. It says, congratulations on your anniversary, LAB360. Keep up the good work. So if you could shed more light on Mr. Olalekan Saidi's question, I think we can wrap up from there. Thank you. Another question just came in asking, do you have plans to open in Lagos? So you've got 2 questions to answer, Mr. Joseph.
Thank you for those questions. I think both questions, they tend to be within the same neighborhood. Currently, we are celebrating 1 year, and we started off in Abuja. So Abuja stands to be our flagship. However, we have plans, to penetrate the nooks and crannies of Nigeria. So currently Abuja is our only hub, but in the foreseeable future, we tend to penetrate, or have a footprint, across Nigeria. And of course, that includes Lagos. But currently, we're just in Abuja. These are 1-year celebrations. So hopefully, when we're celebrating 5 years, we should have, a very strong spread across Nigeria. I hope that answers both questions.
Mr. Joseph, I think you've answered all the questions. I'm not sure we're expecting any other question. If there's any comments, I've not seen any. So as a wrap up, before I push forward, I think what we'll do after this webinar is to send all our list of tests to all the attendees. You share with your friends and colleagues, and just kindly note that all the tests we run the results are given to you same day, maximum 6 hours from the time of collection. And I think we can transfer to Mr. Joseph to continue the meeting. Thank you.
Okay, thank you very much. I can see some pops up on chats. I think most of them are majorly congratulatory remarks. Okay, greater height, an opportunity for patients with NHIS card. Currently, I don't think we've got any partnership or collaboration with the NHIS, because I think that is government spearheaded. But something we could look into so that at least we tend to accommodate everyone, in our practice. So we'll take note of that and see if we can start off a discussion with the NHIS. Yeah, we offer home service as well. So that's for patients or customers who would want to be attended to in the comfort of their homes or in their offices. All you need to do is to give us a ring, and would definitely get across to you in the shortest possible time. So that's one service we offer, regardless of where you live within Abuja. So it's an exclusive reserve for Abuja inhabitants or those residents in Abuja for now. Obviously, we're going to have a spread in the coming years. So we've got home service readily available, and you could take advantage of that. I see Dr. Austin. Thank you so much, Dr. Austin, for making our time to grace us with your presence. Dr. Austin is a specialist doctor. I think I've worked with him in the time past. Thank you so much, Dr. Austin, for making our time to be present, in this webinar. Thank you, thank you, thank you. I think we can draw a curtain to this webinar so that we can all go ahead with our normal activities. I want to say a big thank you for everyone who made our time to be present, for this webinar, and, celebrating with us at LAB360. And we pray that just as you've come out to celebrate with us, when you celebrate as well, there will be people, who would stand by your side and stand behind you, to celebrate your wins and your success as well. Thank you. I'll hand over to the host now, who would maybe give the final remarks, then we'll call it a day. Thank you very much.
Thank you so much for your time and participating with us on this event. It means a lot to us and we do not take it in any way for granted. Thank you, Mr. Joseph, for your time. Thank you for the presentation. It was worth our while and it was very insightful, as majority have said. So yes, we come to the end of our event and God bless you. Do have a lovely evening and weekend. Bye.